My name is Christopher Edwards. I am a licensed clinical psychologist and a psychoneuroendocrinologist. I worked for and with sickle cell disease patients for about 23 years.
My name is Richard Robinson. I'm 52. I have SS, which is supposed to be the worst type of sickle cell.
Alexia Howard, and I have sickle beta thalassemia type S.
Hello, I'm Shakisha Henderson. I'm 20 years old and my major is public health education.
My name is Valerie Chandler. I am 39 years old and I live in Decatur, Illinois. I have sickle cell hemoglobin SS.
So good afternoon. My name is Otissa Marble. I am a mother of a child who was born with sickle cell anemia. My child's name is Corey, so I'll refer to him as Corey throughout the questionnaire. Corey.
Hi, I am Jessica Miller. I'm 26 years old. I go to North Carolina Central University, and I am a clinical psychology major, a grad student.
We have an integrated medicine clinic where we do addiction medicine, mental health, and primary care services. We do have a couple of sickle cell patients at our clinic. We do have a couple of patients that for various reasons were referred to us for Suboxone or buprenorphine treatment as opposed to any of the other standard opiates, Oxycontin, oxycodone, those kinds of things.
I was told, they told my mom when I was 6 months old that I won't make it past 18. Then they said I won't make it past 30. And now it's like, I'm at that threshold where I can hopefully live longer, but there really is no study of men, at least with men, over the age of 50 with sickle cell.
Out until I was 30, pregnant with my son.
Tell us a little bit about this sickle cell disease and some of the stuff that you've been through.
Well, I found out I had sickle cell at birth, and I didn't really have any complications that I remember until I got a little bit old enough to understand what it was. And all I remember really is just going back and forth to the doctors, and I asked my mom, why am I steady going to the doctors? And then that's when they explained to me, and they were ready to say, well, you have sickle cell, this is what it is, and you just really have to, take care of yourself a little bit more. My leg went numb. It's like tingling. Feels like somebody is just like stabbing you, crushing your bones. And it was like to the point where it's just like my face is like bright red because I'm trying to hide it. But it's like really nothing that you can hide. And so it's just to the point where sometimes you just have to give up and say, well, this is just the battle that I can't fight. So I had to go to the hospital. And they actually kept me, and I found out there that I tested positive for A and B flu. So that kind of added on to the effects of just the sickle cell alone.
So the first time I was diagnosed with sickle cell was at age 2, and I believe that is when I had my very first sickle cell crisis. I don't really remember my first crisis. The first one that I can remember is when I was about age 5. I just remember feeling this excruciating pain in my back, and it was a wrap from there. I was in intensive care, intubated, all kinds of things, coma.
I think it was a nurse or someone with the Sickle Cell Anemia Association came to my house and told me that he was tested positive for sickle cell anemia. Although my son is the victim, of course, with people living with sickle cell anemia, they experience a number of different issues. Pain crisis is the most common thing that they experience, as long with damage to organs and things of that nature. Nervous, I'm scared. Corey has been pretty healthy for the most part, but it does make me nervous, to see him in pain. It's disheartening because there's nothing that I could do. When he was younger,
It's undescribable. It's kind of like, I don't want to say crippling, but you just feel, I guess, like your muscles contracting and the pressure, and then sometimes it's hot. It's just very uncomfortable. And when I was younger, I couldn't explain it. I would just like go inside myself and like get in the fetal position and just like need comfort. I don't know, but hopefully I find a better way to describe a crisis. But it's something that I can't translate in words right now.
But my mom, she never could deal with it. She never took me to the hospital. But that's something between me and my mom. You know, I have a strange family. So me and my mom don't get along. Dysfunctional. I guess that's a better way of saying it.
How has having sickle cell disease impacted your relationships, whether it be family relationships or personal relationships, dating wise, friendship wise?
I have this saying, 7 billion people in the world, the only person I can depend on is me. I'm not in a relationship. It's hard for me to have a relationship, partly because I'm a man and I have stereotypes of myself. Secondly, it's just hard in making commitments, meaning a lot of people tell me to volunteer and it'd be helpful to kids or whatever. But I tell them I can't volunteer because I don't know when I'm going to go into crisis. And I don't care what you say. If I was a kid and somebody said they was coming and they don't show up, yeah, I would understand them being sick, but would I really let it go? You know, would it really affect me if somebody said they're going to be there and they didn't show up? So that's one of the stereotypes that I have.
Well, at that point, I didn't have one. I mean, being that I was pregnant, that was my focus. And I mean, I didn't know what to expect. I'm just learning I have sickle cell. I'm clueless. What does that mean for me? And just had no clue. And then kind of leading in towards that.
Some of the things that your friends do, you can do them, but there are limitations to them. And my family, we are very like close. So my mom, my aunt. I know a lot of people say your parents shouldn't be your best friend. They're there to coach you through life. But I feel like that my mom, my aunt, my grandma, all of those people that's like around me, like they're like my best friends. Like I talk to my mom and my aunt every day. So it's just like, I'm hurting today. Let me call my mom. Or something's not going on, I'm calling my aunt. Or I call both of them. But it's just like they're just so supportive. They honestly didn't want me to come 2 hours away. They wanted me to go somewhere closer. My friends are really supportive. I just, have to let them know, like, hey, I can do what you do, but it's a limit. A lot of people don't understand really what it is. And sometimes, like, I'm not ashamed to say, I have sickle cell. But I just feel like it's just, I get a lot of questions, why is your eyes yellow? But my friends don't, they don't ask me that out of respect. But, like, if I do happen to get that question, it's like, I have sickle cell and I wear that, proudly. I'm not ashamed of it.
So, although my son is the victim, of course, with people living with sickle cell anemia, they experience a number of different issues. Pain crisis is the most common thing that they experience, as long with damage to organs and things of that nature. But as a family member, I am impacted because of the fear of losing a child. So I'm always, walking around on eggshells, or I'm always on pins and needles. I'm always in fear that, Corey would, go into crisis, or, of course, the ultimate fear is that he'll die, from sickle cell anemia. I know, I was always very cautious of him. I was skeptical to let him play sports because there were so many things unknown. I didn't know what would happen to him, and I've lost a lot of sleep when Corey was a child, not knowing, if he was going to live a normal life. And then even now, when my phone rings and I see it's Corey, I always answer, hoping that he's okay and that he's not in pain, or, if he goes out of town, or if I go out of town, I'm always worried that something will happen to Corey while I'm away. So there's a lot of emotional and mental impacts that come with that, I used to fear at work that I would not be able to keep a job because if Corey's out sick, as a mother, I would have to be with him. So I always worried about telling my employers about Corey's illness out of fear of how I would be treated.
The disorder affects my social life somewhat. So I like to think of myself as active because I am. I like to work out. I like to hang out with my friends. I am 26.
Mm-hmm.
But sometimes my friends don't understand, my challenges and my struggles with, certain tasks. As in, you want to party 3 days in a row because it's your birthday. On the second or third night, I am fatigued. And instead of, my friends thinking, oh, maybe it's due to, disease symptoms, it's Jessica's flaking or just.
So your friends are aware that you have sickle cell disease?
Yes, okay. Exactly. But if you do not have it, you may think, me not wanting to join you is me, neglecting you or, something like that, and not.
Or like you said, flaking out.
Patients believe that providers don't have empathy with the daily experiences that they have. For example, I would like for you to think about taking your hand and smashing it in a door and leaving it there. What would be your response? What would be your behavior? What would be your emotions? What would be your thinking? Sometimes that is the experience that patients with sickle cell disease are having when they present to the emergency room or when they call for care. So, do they have urgency? Yes. Are they frustrated? Absolutely. Are they angry and upset and sometimes hurt and crying? Absolutely. And so, I think when you want to force them to sit quietly and wait behind 20 other people, when you want them to be patient and recognize that there are people who came before them, simply ask yourself, what would your behavior be if you had just slammed your hand in the door and your hand was still in the door? You would talk to people with great urgency. There would be pressure behind your speech. There would be a sense of, I need you to do this right this moment. I need you to make me a priority. I understand what other people are experiencing. But that has nothing to do with the fact that my hand is in a door. That is what is missing from many providers that see patients who have sickle cell disease.
Sickle cell. I asked my doctor just the other day, why don't y'all talk to me about sickle cell, do some studies and see how to make my life better. And making my life better, you make other people's life better with sickle cell. So, basically I asked him, why don't y'all ask me anything to understand what sickle cell is? And I guess the first answer or what I'm thinking is because it's not as big as cancer. It doesn't affect people who have cancer, if you know what I'm saying. So, it's a painful disease to have when you go through a painful crisis. And I even talked to this nurse, I was like, y'all are so emotionless. You know, I understand sympathy and empathy, but y'all don't have none of that. It's like they see me and it's like I'm in pain and it doesn't even fade them. And I understand that they have to do that so they don't have burnout early in their life, but it's like the way they're taught is it's like to just ignore somebody. I mean, I've gone to the hospital where thought I was gonna die. I was in so much pain. Well, actually, I've gone to the hospital where I wanted to die because I was in so much pain. And the hospital staff shows nothing. I get nothing from them. No emotions whatsoever. It's like they went to school to train so they won't show no emotions.
This time it was actually one of the quicker stays. I went in, I registered myself. Like I said, my parents stay, 2 hours away from me. And so my mom can't, her schedule isn't as flexible as my aunt. So it's literally 10 o'clock that night. My aunt coming from New Bern and she comes up here. But I'm thinking I'm going to be in the waiting room for an hour and a half because that's how it is back home. They don't pay attention to us like that back home. But as soon as I got here, they sent me to the back. They took my vitals, took an EKG, and I think I was back there for like 10 minutes. And as soon as they got a room, they took my blood, gave me medicine, and put me in a room. So it was just like their main focus was to try to like alleviate that pain because I was like, I couldn't walk. I don't know how I drove myself there. I did, and like now that I'm thinking back on it, I'm just like, I don't know how I did it. But it was actually one of the smoother. It went really smooth, and I didn't think it would go as smooth because the longest time that I had to wait was back in June when I got sick. I had to wait in the emergency room for roughly an hour and 30 minutes, and it was so bad too, where I had to I brung a heating pad with me, and I had to plug it up and just wait it out. I'm crying, like it hurt so bad, and it's just to the point where my mom, she doesn't want to. She was like, my child is crying, like can somebody help her? And once we finally got back to in the back, the nurse actually said, hey, you were here last night. I was. They sent me home because they was like, yeah, and they didn't send me home with any medicine. I just told them that I was having sickle cell pain. They actually gave me medicine, and they sent me home on 2 Percocets. And I'm like, I don't take Percocets on, like, when I'm in a crisis, never had. The nurse was like, I seen you last night. And she was like, yeah, you looks, it's not getting better. And so they gave me medicine, and like, she was like, we're going to get this on the road. She was like, do you want to stay here or do you want to go home? But she was like, for me personally, I really don't think you have an option because I really want you to stay here because you were just in pain at home. So we're going to keep you. So it was just like, I didn't want to stay, but I appreciate her for saying, we're going to keep you and not giving me an option because I know if I would have, because me personally, I wanted to go home. So if I would have had my option to go home, I probably would have took it, and it probably could have left to me going in shock or something.
The nurses are pretty cool at the hospital. But the thing is, I've experienced it, for me personally, but I have a grandmother who, she just passed like in October the 4th, but my grandmother had sickle cell disease too, and just seeing how they would interact with different patients, like they would interact better with me than they would interact with her because I don't know why. Maybe she wasn't as vocal or she couldn't advocate for herself like I would, how they would speak to, different patients. But
Hospital, they have, it's in another newspaper that they're number 1, basically, dealing with sickle cell. And I'm like, if they're number 1, I would hate to see number 10, even number 2. When I go to the hospital, my experience is I've been there where the valet parking, they're supposed to, when you get there at the emergency room, they're supposed to park your car and let you go into the emergency room. I've been there where a guy told me I need to go to another parking lot, park my car, come back, and now I'm walking, doing all of this, and park my car, come back, and then check myself into the emergency room. That's what one guy told me, because they're full. Their parking lot is full. Then I get in the hospital, check in, and then it's like I have to wait. You know, they're supposed to have a protocol where the only people that's supposed to be ahead of me or be seen before me are basically people that's dying or about to die. And then I'm supposed to be like number 2. It's like they got 5 criteria. It's 5
levels.
Yeah, 5 levels. I'm at level 2. I'm supposed to be at level 2.
So level 1
is you dying, gunshot wound,
Okay.
something like that. You're having a heart attack. Level 2 is sickle cell. I believe level 2 is it's not because level 2 I could have a lot of pain. It's not that. It's because going into a crisis I could have a heart attack. I could have a stroke. So that's why it's level 2. It's not because of the pain. But, you know, I'm there because of pain. So anyway, you go in, you check in, you see a nurse, they triage you, get your blood rate and high blood pressure, blood rate, your blood pressure, your oxygen level, and your temperature. Then, you know, if they have rooms, they'll take you back to a room. That's where the level 2 comes in. However, I've never been in there less than 3 hours before I've gotten a room. So I go back in the waiting room. Luckily, they do provide a pain shot of my medicine that I take is fentanyl. I'm allergic to Dilaudid. So they do give me a shot of medicine, and I can get it once every hour. And that's how I know that I've been there at least three hours. So my 3 hours passed, and now it's like, okay, I'm at hour 4. It's like, okay, well now we're gonna check you in. Well, you were supposed to been check me in. So now they check me in. So I go to the back. I'm finally in the back. I have a protocol. I've been had a protocol where I'm supposed to go on the PCA. That's basically I hit a button to control my medicine, to control my pain. I'm supposed to have that. It's been there since the early 1990s, because I'm 50. I'm in my 50s. That protocol has been there. But these doctors, they feel like they can reinvent the wheel. So instead of they putting me back on the PCA or immediately putting me on the PCA, they want to think about it. Well, some doctors even started the shot over. You know, now I got to get another shot. You know, so that prolongs me having pain, help for my pain, because the PCA gives me pain at a more frequent rate. More frequent time, which provides me less pain. But instead of me experiencing that, I got to experience them feeling like, well, we don't want to do that just yet. Even though it's here in black and white, we don't want to do that just yet. I want to do it my way. I've gone to the hospital and waited 12 hours before they done one thing to me. Before I even seen the doctor. I'm not exaggerating. I waited 12 hours at one time. Now, granted, that was the most.
I don't go anywhere else, only because, you know, I feel like, especially when I go to do the blood work, and Ranitha, which is the nurse practitioner there, I love her. She's so personable. She answers any questions. She addresses my concerns all the time. And always available if I have questions, especially about lab results when I'm looking at, because I've gotten to the point where I try to look at, when I do the blood work, like what's different, what's high, what's low, what does that mean for me, what's baseline or normal for me, versus looking at it and be like, oh, it's so below what normal is, but that's my normal. You know, so a lot of that, I'm using my resources as far as do.
So the first thing that I like to do with patients who have sickle cell disease is really just to talk to them, engage them in conversation. They're more than just a disease. There are patients with sickle cell disease, and that means that they're bigger than just their disease. The second thing that's important is to empathize with the experiences that they have. They sometimes talk about things that are wild and almost unbelievable, but in the context of what we know about healthcare and inequities, it's very believable, some of the experiences that they have. The last thing is then getting to the technicalities of their emotional status and their pain and their suffering associated with disease, which is sometimes smaller than the consequences psychosocially that they have trying to find management of their disease.
Typically, any of those methods come in handy. In some cases, you have a primary care provider who says, I think this person would be an ideal candidate for buprenorphine treatment, or you may have a friend who does it by word of mouth. Some may have uncovered us on the internet. Any of several different methods come into play in terms of a patient being referred to us. I would say, at least from our experience, the word of mouth has been the bigger opportunity in terms of having success in terms of traveling, in terms of recruiting. I think what we've seen more and more, the patient interaction with the providers or with the staff at the office plays a very big role in how that patient feels about themselves or about their disease state or the degree to which they are enabled to have more hope in terms of going forward. If one, first and foremost, they have an official diagnosis of sickle cell disease, I would, in as much as possible, caution that person to avoid, the alcohol, to avoid the dibbling and dabbling, as you called it, with any of these other drugs, and stick to what is prescribed. In particular, in African American communities, we tend to do a lot of self-medication, if you will. Well, my cousin Ray, his grandmother said to use so and so, or they've tried this and they've tried that. But I think understanding the serious nature or the seriousness of the disease, I would suggest that it's best to stick to what's being prescribed and stay with the regimen that's being asked of you, and stay focused with that. One of the things that you want to avoid is taking something that's not prescribed, and then you're having a drug interaction that you didn't anticipate, and then you have an even bigger crisis on your hands that could be life-threatening.
Okay. So what would you recommend for something like the behavioral health and wellness integrated clinic for the clients that we get in? What are some resources that we could take as health educators, providers, caregivers to approach those clients that may feel like we don't understand what they're going through because of having that substance abuse and us not looking at them as if they are drug addicts?
Education is key. I think it goes a long way to have that patient understand that you do understand. And frequently they will be blunt enough to ask you, well, have you ever been addicted? Or do you, have you ever been into treatment, or do you have a family member or something like that that's been with it? And in as much as possible, you communicate to them that you do have an in-depth understanding of what it is to be addicted, not only from a behavioral standpoint in terms of the behaviors that you do, but also in as much as you can from a pharmacological standpoint. If you, in ways that you can help them understand what drives certain of their behaviors. Why is it that when first thing I wake up in the morning, the first thing I want to do is go get a fix? That's because you've been in sleep all night and your levels have dropped, and so now the brain is craving, and so everything in you is being driven to meet that craving.
I think it's also important that we begin to educate professors and administrators. When you are having a crisis and you just took a narcotic, you may need to delay that test. You may not be the most effective at integrating new information or learning. You may not be great at recall. And so giving them allowances that allow them to postpone a test without it being punitive, to request additional resources without it drawing unnecessary attention, are things that we have to provide to patients with sickle cell disease as standard of care and standard of operation, not based on some huge request or a big administrative change. These should be things that are provided to all patients based on what they need to be successful at the university.
With sickle cell disease, let's see, it was difficult because the doctors that I was used to and, knew were back home. So when I did get sick and I had to go to like a new doctor or like a new hospital, just getting acclimated to, their system and their doctors were different. And sometimes unbeneficial. I would have to actually travel back home to get sufficient care. So it was difficult. I'm thinking on times, and this was like in undergrad, where I had to travel from, Durham to my hometown, which is like 45 minutes away mid-crises, because I would get service quicker.
When I got here to college, the transition I really wasn't worried about the sickle cell aspect of it, because I try not to stress myself out. So when I got here, I try to bring, all my medicine, everything that I need, so that, because I stay 2 hours away, I'm from New Bern. But I tried to bring everything that I needed, but I got sick last February, but I had the flu. And then it sent me into a crisis, and then as I was in the hospital, my chest was hurting, so they found out that I had pneumonia. But that was they couldn't find anything at first, so I actually had to do a CAT scan, and that showed that I had pneumonia, which kind of took more time to get over. But when I got back here to school, it was a rough transition. It really was. But my teachers wasn't really working with me. My major then was biology, and I was already thinking about changing it, but that, I guess, kind of gave me the extra push to change it. And so now I'm finally happy with where I am, and I'm not gonna say that I'm glad I had a crisis because of it, but I just think that was just, I guess, a setback, and it kind of pushed me to where I really wanted to be in the end.
We understand, mental exhaustion and physical exhaustion, but I feel like a lot of people understand the latter more. But, you're supposed to be able to read, you're supposed to be able to write, you're supposed to be able to, do these things for long periods of time as a student. And I believe I can, and I take, breaks and studying increments, but how has it affected me as a student?
On a lot of my work, I'm still currently making up work, trying to figure out what am I gonna do as far as makeup work. My teachers let me make up work. Just how am I gonna, my overall standing in grades. I have 2 online classes, so they don't really communicate with me like that. So it's just, I found myself stressed out, my grades are so important to me. My parents didn't really push academics on me. I did it for myself, and so for that reason, they kind of hold me to a certain standard now that I did that for myself, and I think I appreciate that a little bit more now.
It really just depends. It really just depends on how I feel that day.
Okay.
Or, really how I feel that day. Sometimes I can, and sometimes I need more breaks, or sometimes it's going to take me longer on an assignment. I have this weird thing where, I can't stick to one assignment for too long. I'll work on multiple assignments at once, just because, but that could just be the student in me. So, I don't know, but I drink a lot of coffee, and that affects me negatively, because you're supposed to stay hydrated, you're supposed to drink water, but if I am tired and this assignment still has to be done, I'm going to do what's necessary to complete it.
I think what a parent would want to do is really ordered and really sequential. The first thing I would do before taking my child who had sickle cell disease to a new location for school is I would provide a list of all the healthcare providers. I would find the hematologist, I would find the primary care providers that are most familiar with sickle cell disease, and I would provide that list to my child so that they had it readily available. The second thing is I would make contact with those docs. Talk to them, interview them, chat with them, find out who's going to be the best match for your child. That's really, really important. The third thing, what are the emergency resources that are available on campus? Is the student health prepared to manage a patient who is in crisis, who may have narcotic needs, who may have infusion needs, who may have hematological needs? What would be the closest resources? Lastly, it would be educating the administration that my child is on your campus. Their safety and security is now your responsibility. Share it with me. And these are the kinds of things that they need. So if they have disability services, for example, on campus, contact that office before you leave. Make sure they know your child is on campus. Contact student health. Make sure they know your child is on campus and has specific needs. Find your child's best friend, whomever is going to be their roommate. Make sure that they understand what the needs of your child is going to be. If your child is laying there and is difficult to awaken or is having some sort of crisis, you want that roommate able to call you, to reach out to you, and to provide care until someone could get there to help your child. So the goal is to make sure you identify and delineate resources for your child, that you notify the university, and that you make initial health care contacts for your child and on your child's behalf so that in an emergency you're not trying to find that information.
Was talk to the patients, talk to them. You got to understand what their day is actually like dealing with this particular disease. You know what I mean? And in as much as you can, if you're a professor, in as much as you can, having the student in your class for an hour and a half, understand what that hour is truly like for somebody who's having pain, you know, or somebody who has to. Who has an urge to go to the bathroom, you know, and trying to sit through and trying to focus on what you, the professor, are saying, as opposed to being caught up in the pain that they're feeling or anything else like that. So I think not only in terms of talking to the patient and understanding what's going on with the patient, but you, the professor yourself, needs to become educated as to what's truly going on with that patient and find out how you can assist and make it more functional for that patient.
One of the first missions is to educate, and in terms of educating, it's not just educating the providers, it's educating the providers of tomorrow. How and what do you expect to see when a patient with sickle cell disease comes to a clinic? What are their experiences? What are their needs for hydration, for example? We recognize that being hydrated is a very salient part of sickle cell disease management. And so do we have places in the dorm? Do we have facilities that are around campus that provide hydration to this population? You mentioned heat in the winter. Sometimes, particularly when they are in crisis, they are cold. They are cold when it's hot outside. They're cold when everybody else has the air conditioner on. And so providing access to blankets and to facilities that would assist them to heat themselves becomes an essential part of having increasing numbers of patients with sickle cell disease on campus.